Generalized Anxiety Disorder, or GAD, is a mental health condition characterized by persistent and excessive worry that is difficult to control. Unlike occasional anxiety that arises in response to specific stressors, GAD involves chronic, widespread anxiety that often lacks a clear or immediate cause. People with GAD may worry about a variety of everyday issues, such as health, finances, or routine responsibilities, and this worry can persist for months or even years. For individuals with developmental disabilities, GAD may manifest differently, sometimes presenting as irritability, withdrawal, repetitive questioning, or physical symptoms like stomach aches or restlessness. As direct care staff, it is essential to recognize these signs early and respond in ways that reduce stress and promote a sense of safety. One of the most challenging aspects of GAD is its tendency to interfere with daily functioning. People living with GAD may find it difficult to focus, relax, or sleep. They may seek constant reassurance or appear unusually tense or on edge. These experiences can be especially overwhelming for people with developmental disabilities, who may already face difficulties with communication, emotional regulation, and sensory processing. GAD can heighten existing challenges and lead to behaviors that may seem confusing or disruptive unless the underlying anxiety is identified and supported properly. Understanding the causes and contributing factors of GAD can help staff take a more empathetic and informed approach. GAD is believed to result from a combination of genetic predisposition, brain chemistry, personality traits, and environmental stressors. People who have experienced trauma, instability, or chronic stress, especially during childhood, are at higher risk. In the case of individuals with developmental disabilities, anxiety can be compounded by social exclusion, difficulty understanding their environment, or even previous negative experiences with caregivers, healthcare providers, or unfamiliar situations. The unpredictable nature of some support settings can also inadvertently increase anxiety levels if routines are disrupted or expectations are unclear. For staff supporting individuals with GAD, consistent routines and predictable environments are essential. Maintaining a structured daily schedule helps reduce uncertainty, which can be a major anxiety trigger. Simple steps such as preparing individuals for changes in routine, providing visual schedules, and using clear, calm language can go a long way in easing anxiety. Whenever possible, staff should give advance notice before transitions or changes in activity and check for understanding. Individuals with GAD often feel overwhelmed by ambiguity or the unknown, so being upfront and honest, even when the news might be disappointing, is better than leaving them uncertain. Another key strategy is to validate the person's feelings without reinforcing the worry. Rather than offering false reassurance like, "Don't worry, everything will be fine," which may not feel true to the person, staff can respond with grounded empathy. "I can see this is really bothering you. Let's figure out what we can do together." Helping individuals build coping skills, such as slow breathing, using a calming object, or engaging in preferred sensory activities, can empower them to manage their anxiety in healthy ways. Be patient. What seems like a small trigger to one person may feel overwhelming to another. Physical symptoms are common in people with GAD, and they may not always be recognized as anxiety-related. These can include muscle tension, headaches, fatigue, gastrointestinal issues, or trouble sleeping. For individuals who are nonverbal or have limited expressive skills, physical complaints may be one of the only outward signs of distress. Staff should avoid assuming these symptoms are just part of their disability and consider whether underlying anxiety could be contributing. Keeping logs of symptoms and identifying patterns can help medical or mental health professionals make better informed treatment decisions. When working with individuals who have GAD, staff should also be mindful of their own behavior and energy. A chaotic or stressed out caregiver can unintentionally increase anxiety in the people they support. Maintaining a calm tone, modeling self-regulation, and setting clear, supportive boundaries can help foster a stable and reassuring environment. It's also important to know when to seek help. If anxiety appears to be worsening, interfering with daily activities, or leading to harmful behaviors, the individual may benefit from evaluation by a healthcare provider. Medication, therapy, or other interventions might be appropriate, depending on the severity of the symptoms. Ultimately, supporting someone with generalized anxiety disorder means creating an atmosphere of understanding, safety, and respect. By learning the signs of anxiety, reducing triggers, and offering consistent support, direct care staff can make a meaningful difference in the daily lives of those they serve. It's not about eliminating anxiety entirely, but about helping people feel more in control of their thoughts and bodies, so they can participate more fully in their world with confidence and comfort.